I was from a rural community, which is a little bit harder to gain access to. I'm the eldest of four, so, they couldn't really foot the bills forever. I think my heart has just been wanting to help people, and that's the simplest thing. That's the simplest and purest form of what I do. Particularly getting onto plastics, that was very strategic, and that was hard work. But everything else before that was almost not accidental, but it was just, fingers crossed. But again, I didn't think about it.
Yeah.
It was, I get asked by junior surgeons and other junior female doctors, what about the timing? And I'm like, oh, look, there is no good timing.
That's right.
There was a lot. And, it's quite isolating as well.
Yeah.
The study is, like you're saying, sitting at your laptop.
Yeah.
I was always in a garage somewhere studying and hiding so the babies couldn't smell me.
Yeah.
So without further ado, this is Skin and You. If you are listening, I hope this helps you glow, whatever that might mean.
Kelly, you have had a huge amount of education and a huge amount of accolades behind you for such a young female plastic surgeon. Was medicine always something that you wanted to get into?
Yeah, absolutely. I was never unsure about that. I was just always finding the pathway in. I was from a rural community, which is a little bit harder to gain access to, those elite schools and things like that. But I just worked hard. So my pathway wasn't direct. It was a bit roundabout. I did radiography first, and then whilst I really enjoyed doing all of that, realised that you don't quite have the patient continuity that I was really after. So third year of radiography, I applied for medicine and got in, and worked for a year just to make sure I was fully qualified as a radiographer in case it didn't pan out. But
always good to have a backup.
It was my plan B. But, that was so good because I worked full-time as a radiographer through medicine, and that paid my way, which is good. I'm the eldest of four, so, they couldn't really foot the bills forever with education.
It's amazing. So how many years of university study have you actually done?
So university's been 8. Then I did my Masters of Surgery, which is another 2.
Yeah.
And then, but I did my Masters concurrently with junior years as a doctor in Sydney. Yeah.
It's incredible.
Yeah, look, I look back and just think it's just what I did.
Yeah.
But my family work really hard. They were not very wealthy people, but they've got this incredible work ethic, and that was definitely instilled in me from a very young age. And I just went for it. And I was always positioned in a manner that, you can do whatever you like, but you just got to work. And I wasn't, perhaps the smartest kid, but I was able to work and obviously achieve the marks we needed to get and do what I wanted to do. But it's definitely not, the way that most people did it.
Yeah. And like you said, coming from a rural community, do you think, was medicine something that many people you knew there were even interested in, or was just something you were just interested in from the beginning?
Yeah. Look, I think my heart has just been wanting to help people, and that's the simplest thing. That's the simplest and purest form of what I do. And I decided I'd try and be a vet, so my parents took me down to the local vet to have some work experience, and I got to watch a surgery and I passed out, and then I realised I'm allergic to most animals, so that kind of ticked that box. I could only really be a vet for dogs. And, so I kind of progressed from there. I did some work experience with radiography, and then medicine was just always this thing that I was fascinated by, but from those communities, there's not a lot of, women who are doing those sorts of things. There's no real women in who can kind of touch base and have a chat to about how they've done what they've done. But I had a group of friends who studied at school with us, and all very motivated, and they were like my pacemakers. Yeah. If I could just keep pace with them, we'll all get somewhere. And we did. It's so good.
It's amazing.
Yeah, I've got a very good friend who's an obstetrician now, and, they've all done individually very well. So we all just worked hard. But I was discouraged, and a lot of people said that wouldn't happen. But I just found my way, which is good.
And I think, like you said, there's anybody, I think, who's in a place where you probably are thinking a little bit outside the box, rurally, probably being, in medicine and things like that. It's not probably the most common career path for a lot of people. So I think that discouragement's something that you really need, that sort of diversity sometimes to come over it a little bit and then get you to a place where, you just want to do it yourself and work hard enough to get there.
Yeah, I completely agree. And I think, you get grit. Yeah. There's a great study come out from New York a couple of years ago, and it was about raising girls with grit. And I completely agree.
Yeah.
I've got 2 little girls, and it is all about, throwing hurdles and obstacles at them and them being able to overcome that. And some people look at my life and just, it's amusing almost of the hurdles and how they've been overcome. But I just got on with it. Yeah.
Was there anything in particular that helped you kind of get through those kind of hurdles?
Oh, look, it's a good question. I never kind of stopped to think, oh, this is it, that's the end. There was always, okay, how do I do it? There's always a forward focus and how I might sidestep a few things, but there was always a progression in place. And like I said, things weren't categorically unique in the fact that I was from a very smaller school, not from a big private school, all those sorts of things. But, I just went around what I had to do. And, I found so many beautiful people along the way who were willing to, support me, particularly early on in plastics training, like to really get into it and to be able to harness that focus and that work ethic and progress in the right direction. Particularly getting onto plastics, that was very strategic, and that was hard work. But everything else before that was almost not accidental, but it was just fingers crossed we get there.
But it is, and I think that's almost that kind of critical thinking is almost an essential skill, like you said, being as a surgeon, because having to be able to come and overcome a hurdle and think of the next path to how to get through it is probably quite critical.
Yeah, absolutely. And, in Australia, we've got the best training as far as plastic and reconstructive surgery goes. And you think back to all the hard times in surgical training where, you've got all these really, really difficult traumas just through the emergency, all those sorts of things. They really set you up to be able to think on your feet, but it doesn't take the stress away, and that's a whole different process that you have to deal with in the background of actually addressing what's in front of you.
Oh, absolutely.
But I think again, it's grit. You come back to it and you like, okay, we've got this, we've got the training, we can get through what we've got to get through.
And I think that's one thing if I've learned anything from you is I didn't realise, and I think we'll talk about it later, but I didn't realise the both physical and emotional toll being a surgeon would take on somebody, how strenuous it is, both from a stress point of view, but physically on your body, standing up all day, and being at that kind of heightened mental capacity, in a very stressful situation, really, all day.
And,
it's huge.
think, it really is. And I think the busier I get as a surgeon, the more acutely aware of all of that I am, and the more acutely aware of the processes that I have to go through as far as trying to get downtime, trying to make sure my head's in the right space, because I can't afford to have a bad day.
Yeah. No, absolutely.
I can't turn up and be a bit half-baked. It's just, you have to be on your game. And a colleague of mine, I actually had to go at him because I'm like, you didn't tell me I had to be doing weights.
Yeah.
I get really achy, particularly when I'm doing implants and things like that. Like
absolutely.
It's quite a physical job, and at the end of a 15-hour operating day, I'm aching from head to toe.
I can imagine.
And it's big mentally, and as much as you're so happy because you've delivered beautiful results for all your patients, you're exhausted. Yeah. And there can be moments in the day which are stressful and not quite going the way you want it to be going, and eventually we get there, but you've got to change tack a bit, and you've got to be able to think in that moment. So it's really hard, and I didn't appreciate that coming out as a junior surgeon.
Yeah.
And that's certainly becoming more acutely my focus of preparing myself.
Well, yeah, absolutely, because it's preparing your body for being able to withstand that as, for longevity.
Yeah,
that
absolutely.
It's huge.
Yeah, and it's interesting, longevity, what we were talking about before, like it's coming down to just looking after yourself, diet and exercise and focus and meditation, all those sorts of things are becoming very, very important in my day.
Which is interesting because I think that's becoming a huge focus for everybody, no matter what your career is, no matter what your job is now, we're really starting to learn that in order to perform, I think probably in your job, whatever it may be, whether it's a physical job or not, even I know sitting at a laptop all day, it takes a huge toll on your body.
Oh,
that,
absolutely.
We're really, I don't even think we know the full extent of how bad that can be for everybody. So it's really interesting how important that is now to really look after yourself.
Yeah.
If that's, if you want to sustain that, because otherwise the burnout is real physically, emotionally. It really does take a toll.
And I think there's just been this beautiful pivot to accepting all of that as well. Like people have gone, you know what, I don't want to be exhausted.
Yeah.
And I've got 2 little girls, as you know.
Yeah.
I don't want to be the mum who rolls in and it has nothing left to give.
Yeah.
So it is really nice that there's been this acceptable pivot to being able to focus on that as well, which is nice.
Totally. I think, like you said, going back to you, amongst all of what you have done, which is quite incredible, you have also met your partner and had 2 beautiful girls, which is kind of insane, starting a family amongst all of that.
I know. But again, I didn't think about it.
Yeah.
It was, I get asked by junior surgeons and other junior female doctors, what about the timing? And I'm like, oh, look, there is no good timing.
That's right.
And I always wanted a family.
Yeah.
And I was so lucky that I met Nathan and just the timing of that. And he is just such an incredible man, and he's a perfect balance for me.
Yeah.
It's this really nice contrast.
Yeah.
Because obviously I'm busy and it's all a bit hectic and full on, and he's just this beautiful balance.
Counterbalance.
Completely, particularly for our girls. It's just, they get the best of both worlds.
Yeah.
But he's also, busy. He owns his own company and does his thing as well. But he just lets me do what I do, and he's so supportive of that. Sometimes he doesn't know what he's supporting, I'm sure, but he just rolls with it.
Yeah.
But and then the girls, we were lucky. It's a funny story. I didn't actually. I wasn't sure I was going to get onto plastics, and it's so competitive. And I was very junior when I got on, and I thought it might take 3 or 4 years to get on. So I said, let's just have a baby. And then next minute I was pregnant at the interview for the plastics, trying not to throw up on them, and because no one knew I was pregnant. And I was too scared to tell anyone about the pregnancy.
Yeah. What pregnancy?
And I was 5 months pregnant, and I was so sick. I'd lost so much weight.
Oh my God.
So it still squeezed into my suit to do the interview.
Perfect.
And then, it was just all lucky with the timing. They gave me choice of state, and I chose obviously Sydney, and choice of timing. So I said I'd start in July because the baby was due in January.
Perfect.
So it was obviously a lot of work went into all of that, but we couldn't have timed it better.
Yeah.
And then Millie was born during the training program. Yeah. So I had a year off with her just to have
regroup.
To regroup. And the training's brutal. The training's hard. It's
absolutely.
Like I said, it's world-class training here in Australia, but to get that sort of level of expertise, it's really, really difficult.
And I think, like you said, there's no right time.
No.
I felt that with my 2 kids. It was probably 50% divine luck of some kind and 50% just we're going to wing it. Because there was no perfect time. But when I look back at it, it was perfect timing almost, it kind of just worked.
Yeah,
and because we made it work.
Yeah, and
you just get around it.
Yeah.
And the one thing I've learned is little babies are easy. It's when they're bigger, they're harder.
And one thing I've learned is little babies are easier than puppies.
Yes, I have 100% learned that too. Absolutely. But it is, there's no right time. You just make it work,
Yeah, and we have been so lucky that we've had incredible nannies.
Yeah.
I couldn't have done it without any of our nannies. And they've just been such beautiful people who just loved our babies.
Yeah.
And I felt 100% confident with leaving my little ones because I had to just do what I was doing.
Yeah.
But there were fortnights at a time that I wouldn't see the girls in training. And that was really, that obviously doesn't sit well with me. And then that really was a pivotal point for me leaving public positions towards the end and going just privately just to have a little bit more balance.
Yeah. And I think, like you said, that's one of the key things I think we forget sometimes. If you are having these big kind of careers or these big shifts in training and education, again, when kids come involved, it does take a village, and there is
absolutely
so much help. If you can afford it, if you can do it, it takes all of that. Sometimes I look at the people we have around us, because we have no family here directly, but when I look at everyone else we have around to help, it would be impossible for us to do what we did without that. And so, you do have to make that compromise a little bit and sit with that to be okay, because, you can't do it by yourself.
No, and I think everyone has a very different approach to that, and it's such a personal thing.
Yeah.
Everyone, I say that we've got the nanny, and there's a little bit of judgment sometimes, but that's okay. I'm fine with it. That's completely fine, because my little girls have got a stable little world.
Yeah.
They're happy, they're content, and I know that that's okay.
Totally.
It doesn't work for other people, and I get that.
No, absolutely.
And other people,
look, I think you're showing
different.
them what you're doing and what you can achieve, which I think's amazing. Yeah. For them to be able to see that, I think outweighs all the others.
Yeah, yeah. Although my little one went to kindy and told the teacher that I make boobies. That's what mummy does.
I love that.
I'm not so sure what her response was.
Oh, perfect. It's perfect. I think with all of that, did you ever feel like you have to sort of compromise on aspects of your life, I guess, to have both that family and career side of things?
Oh, so much was sacrificed. Endless. My entire 20s and 30s went.
Yeah.
I look back, and I pretty much came out of high school, went straight into uni, and when I decided I wanted to do medicine, I was obviously gung-ho for going for good grades at my first degree to make sure I could get in.
Yeah.
So that entire sort of early, all of my 20s and most of my 30s went to study and to training and to work, which meant I didn't make so many social events, and there was a lot. And, it's quite isolating as well.
Yeah.
The study is, like you're saying, sitting at your laptop.
Yeah.
I mean, I was always in a garage somewhere studying and hiding so the babies couldn't smell me.
Yeah.
It was really, really, really isolating. So there was a really high, there's such a high level of discipline that it takes to be able to do that. And that had accumulated, and I'd acquired that over the years, but it was so isolating.
Yeah.
And I'm so thankful to, the few friends that stuck around to see me emerge on the other side.
Yeah.
It's really been, I'm so thankful that they're still there, because if you don't engage and support those relationships, then
totally. And then
you can't expect they're going to be there.
That's right. And I think you learn those kind of friends that are there, no matter what, you don't have to talk to them.
Yeah, high maintenance friendships were, and they went to the wayside. But, they're also probably not the ones that you
want to keep around.
Yeah, that's
totally
right. So
it is.
Yeah, the high maintenance ones left behind.
Yeah, absolutely. And I think, like you said, coming into plastics probably was quite strategic and so competitive for you, and such a male-dominated space. Do you feel like that's something you still feel like today? Was that really hard pushing through that to begin, and now still as well?
You know what, Amelia? I was fortunately so naive to it all. And perhaps that's because I'm from, a rural area.
Yeah.
I was just so naive. I moved from Newcastle. I studied both my degrees in Newcastle, moved to Sydney.
Yeah.
And I was a bit nervous because I wasn't from a Sydney medical school.
Yeah.
And I thought perhaps that'd have a negative impact on everything. But in fact, it worked to my advantage, because Newcastle's very good at the way they teach medicine. So it had worked well for me, and it put me in a good position. But again, I was still naive. I was attending journal clubs and thinking, wow, who are all these amazing people? And then I realised that they're the competitors. And I'm like, oh, okay.
Yeah.
I need to get the research done.
Yeah.
I need to tick all the boxes. So I am a competitive applicant. But I just had really beautiful people along the way that kind of stepped in and said, okay, you can do this, and let's guide you a little bit, and let's refine a few things. And so I was lucky. And even before the interviews, people just putting their hands up to take me out to coffee to do some interview coaching and things like that. That was really helpful. But I didn't know, like, other people had been seeing all these professionals for, coaches and all these things for months leading up.
Yeah.
So again,
in one way, that probably almost helped you in sort of not so much the naivety, but probably just being more yourself and not so strictly trained in some way, and
Yeah, true.
and stressed by the whole process. I think.
And by that point, I was a junior doctor who was working, and I think most people could just see that I could work, I could get the job done, and my priority was always patient care, and safety, and that's all they needed. That fundamentally, I think that's a really important skill, that you just show up, but then you're trainable.
Yeah,
you're trainable with that art. Yeah,
absolutely, and I think, going on to that, for me, that was one of the biggest things I found with you. So you were my surgeon for my breast reduction surgery, and I think the biggest thing I really learned, I think, speaking to you and speaking to other surgeons, was that kind of patient-doctor bond. I just felt like I feel like I'm quite good at judging people and quite good at sort of reading people in a way and getting a good feel for people. And I just felt like that was, for you, after speaking to you, that was one of your kind of top priorities for me. It was really about making sure I was comfortable, making sure I understood everything. And it just felt like you end up being a friend. I mean, you end up being a friend, but it felt like when I first met it just felt like you were just really open and honest, and of what you could do and what I wanted to achieve. And that it just made the comfort level of everything so much more easier.
Yeah, and I think there's a few things that go into that. I think my priority is just safety. All of my ladies are VIPs, a lot of them to little people. We really need to be conscious in performing these surgeries that, A, we're doing the right thing, we're not going to cause harm and have really negative outcomes, and B, making sure that we roll out of this really well so you can just get on with things. And that's always been my focus, but it comes back to, I just want to help people. Yeah. Like, that's really the simplest form of it all.
But I think that's rare, because I've had other friends who have gone to plastic surgeons and who have just felt like they were sort of shuffled in and out in their consultation. Like, everything was done correctly, but there was maybe a personal element missing, or there was that kind of care of, this is actually a really scary thing, for people. I think some people think, it's a scary position to put yourself into a surgery electively.
Exactly.
And so, sometimes I worry, when you are probably seeing, 20, 30 patients a day for consults, you kind of are just getting them in and out. But it really didn't feel like that with you. It really felt like you really listened, and I think having that bond with a patient and doctor is really important, whether it's a surgeon or any kind of doctor.
You need to be able to. And look, I think plastics is unique, and I think you do get to shop around. I don't like the term, but you do get to shop around for your surgeon with this, because you're not dying. You don't have an acute appendicitis that needs to come out, or a brain tumor or something like that. So you do get to have a look at other people, and I think that's what sets plastics aside. But I think the hardest thing for women in what we do is there is some sort of elective component to some of the surgeries, particularly breast reduction. Yes, there's obviously functional benefits and things like that, but women who come in for that, they've spent years justifying, do they need it done? Should I spend the money? We could have a family holiday, all these sort of things. So I get that there's been a process for those women coming in, and even until they go to sleep on the operating table, they're still thinking, oh my gosh, what am I doing? Do I really need to do this? And it's confronting. And I'm doing so many more younger girls now in the early 20s who just don't want to tolerate heavier breasts because of all the pain they're already in. And that's their first surgery. So I'm sitting there holding their hand while they go to sleep. So because I'm a familiar face, my anaesthetists are amazing, but it's just nice to just ease them through that process. It doesn't have to be so daunting.
Totally.
So I try and do everything I can.
No, but it is, because I think that's one of the biggest, you said it perfectly. I think with surgeries like plastics, when they're chosen, you do spend a huge amount of time before you even see a surgeon justifying to yourself, I think, should I do it? Should I not do it? Can I afford it? I could spend this money on lots of other things. There's a huge mental toll that you take before you even get to see you. And then even I think once you do see the surgeon, again, you probably still question it, and then you get all the risks and everything that come in, and that plays a huge factor. So it's a massive process, and it's big. I was even speaking to my auntie who's in her 50s who's just decided to get a breast reduction, and she said, I just don't know why I just never thought to do it before. You know, I should have done this years ago. And it's one of those funny things. I think it has part to do with being a woman. We're very bad at probably putting others before ourselves, especially when you're a mother.
When you're a mum.
Especially when you're a mum.
Absolutely.
So that plays a big part in it because we're not very good at doing things for ourselves a lot of the time. And surgeries, you know, particularly like you do with breast surgeries and things like that, they do feel like a very big kind of indulgence, I guess.
Yeah,
for
it's
yourself.
almost like a luxury service, isn't it?
Yeah.
Yeah, and I completely get that. And, you know, there's always the contemplation is, am I too vain? Why am I thinking about this? There's so many different factors and elements that come into it. And I always just say to the ladies who are really worried that, you know, we didn't just meet in David Jones one day. You know, you've thought long and hard about all of this. And most of the time when they're seeing me or any of our colleagues, you know, they're just making sure that you're the right fit.
Yeah. And that's why I think, you know, like you said, for lack of a better word, shopping around. But I think seeing a couple, if you are considering it, seeing a few different surgeons, I think is helpful because I think you'll get a feeling of which one's right after you've met a few. You'll see the difference and which one you feel most comfortable with.
Yeah, absolutely.
And I think that makes a big difference because that at least puts your mind at ease to a point. And like you said, you feel more comfortable even the day you're going in.
Yeah, I mean, you've done due diligence in so many respects.
Yeah, it does. And I think it's really interesting with plastic surgery now, I feel like, because in a way I often feel like it's become so much more common, so much more out in the open. And I think social media probably has a lot to do with that, but also probably celebrities being a bit more forthcoming with what, you know, they're having done sometimes.
Yeah.
So it's a really interesting space that it is kind of almost like we're looking behind the curtain a little bit more now. You know, even you look at your social media, the before and afters are incredible.
Thank you.
But they're amazing. And I think there's a lot of maybe less stigma behind it. You know, people don't feel so ashamed of having things done, you know, that they don't have to hide it or anything like that, which I think is really interesting that that's now becoming more common. And you know, a lot of your patients are even for breast reduction surgeries are young women, you know, really young women, which I think for me, someone who struggled with large breasts when I was really young, I just think that's amazing. Yeah. You know, that's incredible that that's now becoming more normal and a possibility for them. Absolutely.
Yeah, I think what I notice with the younger people is they've genuinely got a lot of emotional and psychological negativity around, particularly with breast reduction, the size of their breasts. They're a size 6 and 8 waistline. They're wearing baggy clothes. They can't wear swimwear, all of those sorts of things. So it is having a really negative impact on their lives. And not to say that the older ladies don't suffer from the same things, but I think the mums just get on with it. Whereas the younger ones, they're really quite emotionally caught with it. And you see those girls, they come in with their mums quite often and, you know, early 20s and then having a chat about things, and they're often really quite distressed about the whole idea of their breasts. And
you don't realise the emotional toll.
Yeah, that's right. And it's really, but, you know, they walk back in and they're almost different people. Yeah. Yeah, which is just, and it's such a big difference in the younger patient population that I have, that difference before and after surgery. Yeah. And I don't like to feel like I'm selling surgeries or anything like that, because I'm certainly not, but it is such a beautiful change.
Huge. And I mean, I know you said to me after my surgery it would take a few months for me to get used to it, and it really did. I really felt it, probably even up to 6 months after. It took me a long time to kind of get used to my new body, to figure out how to dress to my new body, to look at myself and think, oh, yeah, that's me. It was literally, it was a huge difference. It was amazing. I just never had realised the emotional kind of processing that needed to happen after that. And I cannot imagine what that would be on a younger woman as well. Because for me, I know, you know, I was master of disguise when I was younger, because all I wanted to do was make myself look smaller. So you do become. It's
interesting. Yeah, a lot of the younger girls, it's they're so good at compression and I mean the bras that they wear are like wetsuit material, these minimizer bras and things like that. So they've had some negative sort of feedback from family members saying you don't even need it, and they obviously don't understand what weighs on their minds, unfortunately. And some of them are a little bit slower to process, and others are just out there, fully enjoying it. They're wearing their cute little midriff tops back in on week 1 post surgery, and they're just rolling with it. It's beautiful.
Yeah, no, it's and I'm sure it's the same on the opposite side of people who get implants who have never had, breasts in any sort of decent size.
Yeah,
I can even imagine that must quite take a long time to process, because it changes everything. It changes the way you dress. It does change the way you feel. It changes the way you look.
But again, they've been masters of disguise.
Yeah.
They've got chicken fillets and push-up bras that have been doing it. And the patients I tend to attract are more ladies who want the natural appearance. They don't want to look like, oh, hello, we've had ear implants. They are always wanting more of a natural appearance. And the aim is usually just to give them what they look like in a push-up bra.
Yeah.
So it's not big volumes and things like that. But it just means that they don't have to design their entire wardrobe around bras and fillets. And
that's the thing, though. I think, like we said before, with surgery becoming, I think I'd say a bit more mainstream, or a bit more at least out in the open, it's taking that stigma away of it's not you're going to look like someone who's on botched. It's a very natural progression, and it's someone who's looking for a natural look now. It's really, very rarely that really over the top done.
Yeah, I mean,
thing.
There's certainly still women who are after that, and each their own with all of that. For me, it's usually about proportions.
Yeah,
just giving you the curves in the right spots, and it's the same for tummies and things like that.
Yeah,
it's just addressing a few things that we didn't have before babies.
Well, that's the thing. Before children, look, everything was a little bit different before children. So
I know.
I was even looking at my belly button the other day. My belly button has changed since having kids. It's just bizarre. So I think to now have these options, which are very doable and really safe, and so in such comfortable hands with someone like yourself, I think that's just an amazing opportunity for women.
Yeah, I think it really is. And unfortunately, women, we're busy most of the time for breasts. You don't spend much time in the mirror looking at things until after your surgery. You just pack them up and get on with your day. Until you become so conscious of something that's really niggling and it's becoming a bit more prominent in your thought processes, that they're heavy, or your tummy, you hate tucking it in, all those sorts of things. Like there's moments that are dictated by it. And that's when people start thinking about those options.
That's right. And I think, we've spoken about matrescence before, of this whole big period of women after they've had children, and how it's actually, there's psychological and physiological changes that go on in our body once we have kids. We know that now. It's a really big thing. And identity, I think, is a huge one in that. And
absolutely.
You feel different. Your body doesn't feel like it's yours anymore. You've got things hanging off it everywhere, like it's
including little people.
Like it doesn't feel, I think identity is such a huge thing for women post having kids. And so when you're looking at yourself and you don't feel like yourself, it's a huge toll that takes. And it's really, I think, hard for a lot of women to process that with everything else that's going on.
Yeah, and I don't know that you get time.
Yeah, that's it, totally.
To process
no,
it.
I feel like it took me about 2 years to just kind of get over having a child.
Happened?
Then I kind of was like, oh, maybe I should sort out some of the rest going on.
I should start doing some Pilates.
That's it. I'm back there now.
Oh, good. Yeah. I mean, post baby, it's a challenge for everyone, and I think some women are better at affording themselves the time to make them feel better about themselves and do the things that they used to love doing and strengthen their bodies and pay attention to that, and others are not, and it's hard, but I think generally women are feeling a bit more okay about. Yeah, absolutely. I remember when I had newborns, I'd be ringing my husband at like 11 a.m. when he was coming home from work.
Going to work is easy. Going to work for men is easy after kids. That's the dream. Totally. It's a really interesting one.
I want to quickly talk about the sponsor of this podcast, Vela Days. Vela Days is a professional strength skincare brand that is all about simplifying your routine. It has 3 highly effective products that replaces an entire 12-step routine so that you can start doing more with less.
Yeah, and I mean, with my little ones, I found it just really isolating.
Yeah.
I think
Totally.
it was a hard shift mentally for me.
Yeah.
To do what I do.
Oh, especially when you're in such a high-paced environment outside of family. To then sit at home feeding all day
I know.
it's
and
very hard.
Gosh, feeding was such a nightmare for me as well. So I felt like I got such tight hip flexors from sitting down feeding all day or trying to feed.
Yeah. I know. It's hard. It's hard. It's
Yeah,
really hard.
it's really, really hard.
I would like to know, I guess, what now are you seeing in your field of surgeries? What are are there any sort of current trends or things that you're seeing that are becoming a lot more common for people to be doing? What is sort of the more popular, I guess, surgeries that you seem to be doing?
Look, I think as a female plastic surgeon, I am seeing a lot more labiaplasties.
Yeah.
That's definitely the highest growing surgery. But you know what? women don't talk about it. And I'll ask all of my ladies, do you know anyone who's had it done?
Yeah.
And they're like, no.
I bet you do.
Yeah, and you get, and that's a really nice surgery. Again, functionally, those women are really uncomfortable.
Yeah.
Really, really uncomfortable. And, but I did an interview for a girl a while ago who was really trying to push me into saying that, we do all these surgeries for men. And it's so not true. These women, they're coming in for themselves.
Yeah.
And I think that's probably a nice thing to mention as well is women are doing it for themselves.
Totally.
Sure, they might want to look good in dresses or just be comfortable or less neck pain or whatever it is. But they're doing it for themselves, which is really, really nice. Yeah. And I think my involvement in that is just facilitating. Yeah. But, so labiaplasty is definitely the fastest growing surgery, I think, for what we're seeing. But in my own practice, it's certainly a movement towards younger girls getting breast reductions, whereas I think typically years ago it was for the mums who'd already had the babies who'd already breastfed. And we know that shouldn't change your breastfeeding potential.
Yeah, and I think that's a really important thing because I've seen you talk about that a lot before is it can mean you can still breastfeed.
Yeah, that's right.
After, which is really impressive and beautiful.
Yeah, I mean, I had one patient. She was from a rural community who went to 13 GPs because she was 21 and wanted a breast reduction, and was a very good candidate for a breast reduction. She had such really, 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 really big breasts, but 13 people denied her just a referral.
That's insane.
Like they all made that decision for her that she was not suitable and that her neck and back pain was not something that, should be addressed with a breast reduction before she had children. So, there's a lack of information.
Totally.
Yeah.
And I think that's really a really good point because I think it's hard sometimes here in Australia. I know derms have this problem as well sometimes because you have to get a referral to see a dermatologist. You can sometimes be sort of gate-kept by a GP, to try things first with a GP, which absolutely that process is really important, but it can make it really difficult as well sometimes. Like you said, that is someone making a decision for her to not even be able to come and speak to you, which is really hard.
And I mean, I can also say if it's inappropriate. Yeah. And there's certainly patients that I say no to.
Exactly, yeah.
And that's, sometimes hard, but it's the right thing for whatever reason for me to say no to
But having
things.
that conversation, I think, so important, being able for her mentally even just to be able to see a surgeon, whether you say yes or no, I think it's part of the process. So I think, it is important to remember because, in the US, for example, you can just go to see a dermatologist, you don't need a referral. So it does make it a bit more difficult here sometimes. But I think, like you said, make sure you can see some other GPs and see what they say and then hopefully be able to, get a referral to see yourself, things like that.
Yeah. And I think the other point to touch on there is make sure you're seeing someone who's fully trained.
Yes.
That's obviously being quite topical in the media of late.
Definitely.
Yeah. And, it's a difficult thing to navigate for people who are trying to find someone who's
And I
trained.
think I'm sure the most important thing is going with a plastic surgeon, not a cosmetic surgeon to begin with.
Yeah. There's our society, Australian Society of Plastic Surgeons, they're trying really hard to help that education process happen. But, there's regulations that are in place at the moment. So it's difficult. It's just difficult.
No, I think one of the funniest things I think I loved you ever explained to me was when you're actually performing a surgery if your breast is mainly mammary, it's like performing it with Play-Doh. But if it's more fat, it's like Jello, which I love.
And look, it's true. You can always look on the Instagrams and I think it's actually that information and the photos really are good help to women considering these sorts of things, and you can kind of usually identify with one or two of them saying that's about me, and maybe that's what I'll kind of look like. But
I think it's so important because you just see a realistic example of what you might be going through. I think one of the biggest things, and I know one of my biggest worries was scarring, and you can really see that there's such a multitude of that across all your surgeries, and it's very barely there. It's so subtle, and and it's. I don't think that's something people need to be worried about.
No. And look, to be honest, particularly for breast reductions, they're not. And I always explain it's a permanent trade.
Yeah.
I'm permanently trading the size and shape of your breast for something that's more youthful and lighter. Yeah. But the trade-off is the scarring.
And you said that to me, I remember, because I was really worried about scarring, and you say, what's more important to you, having smaller breasts or having scarring? And I thought, that makes a lot more sense to me.
Yeah, and I try. Look, women in today's world are very well educated. Yeah. They're on groups, they're on all these things. Yeah. So by the time they're seeing me, they know what they're in for. It's me just ticking all the boxes to make sure I've completely explained everything. And I think sometimes I hear that other women aren't having those conversations with their surgeons, and I need you to sign a form which says you know what you're signing up for. Yeah. And I also have to sign that form to say I'm going to get you through it.
No, totally.
So we need to be completely informed about all of these things, and that's part of the process. But for me, women they're smart.
Yeah.
And
that's the thing.
They
I
understand.
Think you said there's so much out there now, which I think sometimes can be so overwhelming that it is hard to kind of narrow it down sometimes. But it does. I think then by the time you come to you can at least go, okay, well, this is all I know, and you're kind of like, right, well, this is what we're doing.
And this is what I need to know.
That's right. And it makes it much more clearer, because, I think I even know, I felt coming in, I was overwhelmed because I had looked at so much stuff about what to do, and I thought, it's just a lot.
And I think the groups that are available, some of them are really, really helpful and seem like really nice support communities, but sometimes there's a bit of anxiety promoting stuff in those communities as well. So it's about putting it all in perspective for how it's going to look for you. Absolutely. And you actually get to write your own narrative on this. Yeah. So sometimes I'll say jump off the groups because it's too much anxiety. It is. I think you have to call it at some point. Yeah. Because it can be a bit much, and then you can come back if you need help after. That's right. So, but hopefully I've given you what you need.
Oh, completely. From the anaesthetists that you were working with to afterwards, there's so much that you don't by any means feel like you're on your own in any way, which I think was incredible. And so important, because,
it really is.
By the time you leave the hospital, you're like, right, I'm on my own now.
Got my compression bra
off. We're good. But no, it was amazing. And I think that's one thing I was most amazed about, a week after I was back to normal. Which was amazing. I had a few days on painkillers, and then I was okay.
Yeah, and I think that's the nicest thing about breast reduction. It's a little bit different for augments and tummies, but it's always a surprising recovery for ladies, which is nice. Every now and then you'll get someone who's a little bit slower as far as pain goes. But, most people really recover well.
No, it was good. Yeah, and just well managed, I think, which is the most important thing. It was really, that process was very clear, which was great.
Yeah, that's good. We know what we're doing.
Yes, you got it down pat now. Can I ask, both technically and emotionally, what your favourite surgery is?
Look, breast reductions are actually tricky. They're hard. The compromise is always between trying to deliver outcomes, and I talk about breast reductions because that's probably what I do most of. Yeah. But, the balance is always between trying to take enough volume off enough skin, lift them up, nipples are higher, all those sorts of things, but keep everything alive. And I'm sure you remember, like, one of the risks is having tissue that doesn't survive. Yeah. Fortunately, that's, not a big complication rate, but it's a real problem. But for me, emotionally, that's where the delivery of such a beautiful functional outcome is, but also an aesthetic outcome. Yeah. And that's a really big game changer. Tummies are beautiful as well, the tummy tucks. Like, they really just restore what you had. And all the grievances that you have, particularly about lower sort of tummy with the skin, stretch marks and tissue that just won't go away, all that sort of, those
which is something that I didn't realise until I think I'd seen a lot of yours on social is I think I had always imagined tummy tucks as people who just wanted to be skinnier, but it's really not. It's people who have that kind of stretched skin that just is, you know, stretched from pregnancy and things like that. That was a real shock to me. I was like, oh, I get it now. It's not actually just, taking away fat. It's really that sort of skin that is not going to go anywhere no matter how much.
Separation.
And the muscle separation, you know, and no matter how much exercise you're going to do, that's not going anywhere.
No. And that's a real nuisance.
Yeah.
Particularly as we approach 40 and early 40s when you're really like, oh, I just want to be able to wear things comfortably and not have to, you know, Nancy Gans myself.
Yeah. I mean, we love a Nancy Gans here.
Well, you know, have a tummy tuck. It's internal Nancy Gans.
That's
it. Like it's one of those things. So I think everything that I do, I'm really lucky. I'm just working with women and my patients are beautiful.
Yeah.
And, you know, all of those ladies will have a really nice transformation and it's just nice to see.
Oh, and like we've talked about, that emotional change you feel in yourself after something like that is huge.
Yeah.
You know, not having to hide a part of you anymore is massive.
Yeah.
And I don't think you even realise the change that makes on you until it's gone and you're really like how much of a weight that has been taken off emotionally, I think is huge.
Yeah, I had a patient talking to me about how, you know, her husband wasn't entirely on board, but she was just getting it done regardless.
Yeah.
And she was having a breast reduction. And she said that he comments still about how happy she is and how different she is. And that's beautiful. But it also does reflect how much of a negative impact that was having on her life.
Yeah. And she probably didn't even realise the amount that was impacting her, which is a really the hardest thing, I think, because it is. And it is one of those things sometimes. And then when you have it done, you're like, why didn't I do this so long ago?
You know, I've got this beautiful patient. She must be 65, 70, and she's just had it done. Yeah. And her entire rationale for coming in was because she didn't want to be in a nursing home and have a poor nurse lift her heavy breasts up to clean. And I thought, I wish you'd had it done this for yourself like 40 years ago.
Good on her. That is what we want to hear.
I know.
Oh, amazing. Well, I feel like you are only just getting started. Like, I just think you're so incredible for how amazing you are, so young and just phenomenal. What is next for Dr. Kelly Thornbury?
Yeah, look, it's, you know, for me, it's we're, you know, just trying to do some really good surgeries for a lot more women. My focus doesn't really change. It's just about helping women and making sure we can pivot that to make sure it's safe and keep that in line with you know, current regulations and all of those sorts of things. But I just will continue going on, I think. But you know what? There's so many beautiful opportunities coming and and that's nice and it's unexpected too. Yeah. Some things in skincare and things like that we're working in the background doing, which will be exciting to have a chat about.
Really exciting. And I think I hope if anyone is really hoping, you know, or just interested, please reach out, you know, to Dr. Kelly or you know, a plastic surgeon and just have a chat even, you know, and see what might be possible for you.
What the options are.
That's right.
Yeah. I think it's about just getting the right information and what your options are.
Yeah.
And like I said, I think there is a really long process to most women deciding to have these surgeries. You know, most women, it's like 4 or 5 years.
Yeah. And that's okay. You know, I think that's, like you said, that's the process.
Yeah, that is the process. There's nothing irrational about my patients.
Unlike me, who saw you and we booked it in 2 months later. I wanted a quick turnaround.
We could deliver. But I think by the time you come to me,
totally.
You know,
there had been a huge process.
And that's the stressful thing because people walk in, they're like, okay, can I do it next week? Yeah. I'm like, oh my gosh, I'm booked up for months.
Yeah. It's fine. We'll figure it out. You said to me, well, can you travel? I was like, yes. You're like, fine, we'll do it. It's all good. So I love to end this podcast with just one really easy tip, I think, that anyone can do as a daily practice that they can implement tomorrow if they want, just to improve somehow in their overall health. It can be skin, can be anything. I think, just something really easy that people can take away, I think is great. I'll go first so you can have a minute to think.
Okay.
And then, I would love to hear yours because I think it's great to have one sort of easy takeaway. So mine is just a simple one this week. I always go really weird left field ones. But someone messaged me last week on social media and it nearly broke my heart. She told me that she felt like a failure because a skincare ingredient she had seen everyone talking about it on social didn't work for her skin. And she felt like, she'd failed at something, that this didn't work for her. And that nearly killed me. Because I thought that's not what we're trying to do here.
No,
that's not what we should be doing. Sometimes I think, it's so great with social media. We've come so far. There's so much information out there for people from, great people like yourself. And then sometimes I think, well, we still have so far to go. And I see constantly when all these question and answer things we see on social media and, people are still writing in saying, is sunscreen safe in pregnancy? And I think, oh, God, we're still there. So it's hard. So I would just say my biggest tip is just for anyone, if you are confused or overwhelmed or don't know where to start or just unsure, go and see a professional. Just go and see a dermal therapist and get a skin analysis. Most of them do it for free. And just get them to tell you what type your skin type is. Just get them to tell you what you might want to use and just see what they say. And then at least cuts out some of that confusion for you.
Absolutely.
And don't feel like a failure if something doesn't work for you because no skincare works for absolutely everybody.
And I think too, further to your point is it's not going to work for your entire life.
That's right. It changes all the time.
Our pubertal skin is different to our
completely
30s, 40s skin.
Yeah.
Look, I'm going to stick with your train of thought. We have the biggest skin cancer rate in Australia. So for me, it's all about protection. And when I say protection, everyone thinks sunscreen, and that's number one. But number two is all the actives.
Yeah.
Yeah. So it's just having a really good base with your actives to make sure that you're protecting yourself properly.
Yeah.
And then once you've got that down, that's the secret to longevity.
Yeah. No, I love that because it's really important. And like you said, we all talk about sunscreen and it is the most important, but there is so many other things as well that are really important.
Yeah. And, for skincare, I'm not sort of narrow-minded with it. I mean, obviously I'm a plastic surgeon, so I do Botox and I think there's really important roles for all these things as far as what you were saying before. So nutrition and sort of holistic approaches, but then also your active ingredients, sprinkles of Botox, all of those sorts of things. It all kind of works together.
Yeah.
But I think if people are wanting to really pursue a good skincare regime, it's about skin health.
Yeah.
I think it's really nice to see that transition is happening, that it's not about caking makeup on to hide everything.
Totally.
It's about skin health now.
Yeah. And the integrity, I think, keeping the integrity of your skin. And, that's where I say to anyone, there's no point using all this skincare if you're not using sunscreen because you'll do more damage to your skin integrity in the sun in a day than you can fix with all your retinol in the week. You know, it's not going to work that way. So it's keeping that in skin integrity, like you said, through all different aspects of our nutrition, your health, your skincare. There is so many other things that incorporate into that. And I think it's one of those interesting things because I was talking to a friend who said, it's so interesting now you look at your parents and at their age, but they don't look like what your grandparents looked like at their age anymore. It's really different. You know, my grandma, I just feel like always looked like she was 90. Like that was always a nana. And my mum doesn't look like that now. She's a nana, which is interesting.
Yeah.
So it is. I think those changes we're starting to see, sunscreen and things like that coming in, they're working and they work and they're really important. So it's great to
And we've got so much more information now.
Yeah.
So it's trying to, if you're on socials and things like that, it's trying to follow people who are really well informed about those sorts of things and keep across it. And like you said, going to see a professional to help you.
And just like I said, go and
space.
that's right. Go and just get someone to tell you what your skin type is. Even that can just give you a good starting base.
Yeah, changes the game plan.
And changes it totally and is really, an easy thing that everyone can do. So thank you so much, Kelly.
Thank you so much for
Oh my
having
God,
me.
I'm so happy. It's so
We should do this again.
amazing to get you any kind of time with you. So absolutely, we'll do it again. And no, I've loved it so much. So thank you.
Thank you.